The NHS in the North West has been through a period of unprecedented growth. For more than a decade, spending on the region's health has increased by almost 7% a year, while inflation has averaged less than 2.5%. The evidence of that spending is all around us, in increased numbers of frontline staff, in new hospitals, shorter waiting lists, and in new medical equipment which is saving lives in ways which would have been thought impossible just a few years ago.
Since 2000, the NHS in England has received 6.5% growth in its real terms budget every year. And that means that even after taking account of inflation and where wages go up, that they've had 6.5% extra money every single year since 2000.
But we know that this period of unparalleled growth in spending is coming to an end. Like all parts of the British economy, the NHS in the North West has to face up to the reality of the worldwide recession. But we also know that the NHS, unlike many areas of the economy, will not have to endure spending cuts. The budget for 2010-11 will increase by 5% and will be held at the same level for the following 2 years. That's the good news. But what we also have to recognise is that spending over that period will not stand still. Like all parts of the UK, our population in the North West is getting older and requires increasing levels of care. And we also have many areas of social deprivation, which means we have high numbers of people needing NHS care at levels not experienced in other parts of the UK. This leaves us with a potential gap between the income we think we're going to receive and the money we know we're going to have to spend.
Well, over the next 3 years, this organisation, as a leadership organisation, the Health Service, is going to really have to step up to the plate. We know that the money we've enjoyed in the past is not going to be there. We know that the demand that we've seen previously in the Health Service is going to continue. So all that difference between our demand and our current resources is going to make us have to work harder, smarter, more intelligently to close that gap, make sure that the service offer that people get in the NHS is going to be as good as it gets now, even though we're not going to have the same amount of money.
To get round this funding gap, the NHS at national level has come up with the QIPP drive: quality, innovation, productivity and prevention. Ways in which we can improve the quality of care we deliver and save money at the same time. NHS teams are constantly looking at how they can improve services. They are now being asked to accelerate this focus, drawing on their expertise and experience to ensure patients continue to benefit from the best care possible.
One of the most important things that came out of high quality care for all, the work that was led by Lord Darcy, was that quality should be the organising principle of the NHS. Everyone's always been in favour of quality in the NHS, but we've never actually defined what we mean by it. So defining quality as effectiveness, safety and patient experience was a really important thing for us to do, and we focused our attention on improving quality. Now, one of the issues I think that we need to learn in the NHS, that most of the economy has learned, is that it is perfectly possible both to improve quality and improve productivity simultaneously. Indeed, we know from our own experiences that the amount of duplication that patients see when they go to outpatients, GPs, to get tests, to be brought into hospital, to be discharged, they could be streamlined significantly, and we could improve the quality of the experience for our patients and reduce cost. So bringing those two things together is going to be really important.
QIPP can take many shapes and sizes, but there are areas where we know we can save money. For example, can we reduce the amount of prescription drugs that are wasted every year? Can patients and GPs be persuaded to accept less expensive, non-branded medicines? Can we reduce inappropriate use of A&E and 999 services? Can patient appointments be more efficiently scheduled and coordinated with other parts of the NHS? Can we make more use of mobile technology to increase care at home? Is there more we can be doing in the community rather than in expensive centralised units?
Everyone who works in the NHS is committed to its future. We care about the future of its service, and we need to work together to carry forward the commitment to quality in a challenging financial time. Not to say that because money is going to be tighter, we're going to give up on quality. There are things we know how to do that have come from the front line, that if we did them well at scale, across a patch, across a region, across the country, would do both those things. It would drive quality up and help us live in more difficult financial times. Let's focus our energy and effort together on identifying those things and take that commitment and use it to make them happen, secure a better future for local patients and secure the future of the NHS.
The next 3 to 5 years will be challenging for the British economy as a whole. Within the NHS, we are perhaps more fortunate than most, but what we must face up to is the new economic reality without affecting the quality of care we give. In fact, the challenge is for us to improve the quality of care whilst having less resources than we've enjoyed in the past.
Now's the time to show our true colours and really step up to the mark. And as a leadership organisation, NHS North West has got to step forward first, create the context in which people can be brilliant, organise well, tell the story well, engage with the people of the North West well. That's what we've got to do over the next 3 years. I'm very confident we can do it, but it's all going to require a big effort on all of our parts to make sure we can deliver.
QIPP applies to all levels of the NHS and all of us who work in it. So it's up to all of us to make it work.
In the house nearby lives a brown dog. Hello, brown dog.